Today we decided to do a community event that incorporated our small town community that comes to our hospital in a mock stroke drill. We actually went out to the community, did education on the stroke.
Just a couple of quick facts about strokes. It is the third leading cause of death in the United States, and it is the leading cause of serious long-term disabilities.
We're going to go ahead and start with our victim coming in. Tina Graham is one of our nurses who works on the stroke unit. Hi Tina, how are you doing?
What we saw today was a patient who went into a restaurant and then suffered some symptoms of stroke.
Tina, someone, I need some help.
We took it very chronologically right through the steps.
Can you talk to me? Can you talk? No? All right, we're going to call 911. We're going to get some help here right away for you, okay? Someone, would you mark down the time?
And what we would do for that person, including the early recognition by the lay person.
So hi, this is Faith at the Rest Again to Fort Calhoun.
Activation of 911.
Could you send the ambulance, please?
It's okay, Tina. It's okay. We're calling 911. I'm going to stay here with you. You're not going to be alone. These symptoms are very sudden. And just in our conversation, she started to have these symptoms.
A sudden and severe headache, a sudden weakness and numbness of the face, of an arm, a leg, on just one side of the body, a sudden loss of vision in one eye, sudden loss of balance or coordination or trouble walking, sudden slurred speech or difficulty speaking, sudden confusion, and sudden dizziness. In order for that person to have fewer deficits or maybe no deficits at all, it's just key that the public be able to recognize those symptoms and call EMS so that EMS can get them to a hospital that deals with strokes and get the medication that they need or the treatment that they need as fast as possible so that their deficits are minimal.
And one of the critical elements was the time. And one of the big questions that we will ask a patient in the emergency room is, when was their last known well time? And so it's very important if if you're with someone, that if you can kind of take a look to see what time that was, their last known well. So our rescue squad is here.
How you feeling? Hey, let's bring the stretcher over. You take any medicines regularly? No? Okay. Allergic to anything? Any medicines? No? Okay. We're going to get your blood pressure, then we're going to get you on our stretcher, okay? And then we'll probably get you going up to the hospital and check you out. Okay. Well, blood pressure's good. Ben, what was it?
Stroke is one of the major killers, and not enough people get to the emergency room in time. They wait 4 or 5 days, wait a week. It's important to get to the emergency room right away.
Manuel, this is Fort Calhoun 611. We're en route to your facility, ALS code 3, with a 25-year-old female. We were called to the restaurant for stroke-like symptoms. On our arrival, the patient was found to have right-sided arm drift.
Looked like she had some deficit on her right side.
Okay.
Here at Emmanuel, we service a lot of different communities. A lot of small towns around here come to Emmanuel, so it's important to get the education out to them. We work really hard with the squads from these smaller communities and about how the importance of notification, timing on them, and their workup and their assessments on the patients.
Feel the same on both sides? Are you able to say anything at all?
For the hospital itself, just education for our staff. It helps us better ourselves and become more profitable to the patient to give them the best outcome.
Are you on any medications? Okay. Have you ever had a stroke before? No? Had any recent surgeries? Any bleeding? No bleeding in your urine or in your stool? Okay. Is your vision okay? No? Are you having chest pain? Are you having blurry vision?
Amy?
I'm going to just check a few things here. Can you look right here at my finger? Just follow it all the way. You know, there's a lot of moving parts with this. It's coordination between the radiology department, the lab, our nurses, neurology, the admitting nurses and physicians. And so this is a way that we can practice making sure everybody's on the same page. This is one of those things where time is of the essence. And so You want to make sure there's no kinks, that everybody's working together, everything's in motion, and that there's no delays. And it's good to just go over everything so when this happens for real, everybody knows their part and we can work together as a team.
We just set up at a restaurant having breakfast.
So let's get an EKG and labs with coags, another AccuCheck, keep our MPO, no aspirin, no heparin, nothing given right now. Can you raise your arm up off the bed? See if you can hold it there. As in the case here, when you have a young healthy person that has a severe deficit like this, if you're going to get benefit from the medication, it has to be given within 90 minutes. So if you develop any numbness, weakness in your arm, leg, speech problems, confusion, that they need to get to a hospital and get that evaluated immediately and see if that is a stroke, because if you wait too long, the medications are not going to be a benefit.
I learned that it can be very scary going through and being a stroke victim and not being able to talk or, you know, let them know how scared you are or let them know what decisions you even want to make. Not being able to talk and share that with people is pretty scary. And, you know, waiting for EMS and going through that whole process can be pretty frightening for somebody that's not experienced anything like that before.
This is a great opportunity to see how it really starts in the field and how all of the pieces need to come together and how we need to coordinate the care to make sure that we're doing the best for the patient.
Just to be able to know that we touched the lives of those people who were there at the Rustic Inn today, because very probably they will come into contact with someone during their lives who will have symptoms or signs of a stroke. Either they will or maybe their family members or friends, and they'll be able to do something now to help.
It's important for everybody to, you know, pay attention to those sudden signs and symptoms and, you know, making sure that you keep track of the time that the symptoms happen and, you know, making sure that you communicate that with the care team.
I believe that it's our responsibility and that we must take accountability for educating the public in ways to prevent conditions, in ways to recognize, and for early intervention and early treatment. We have a responsibility and an obligation to the community we serve. It was an example of how powerful it can be to reach out to the community and provide education and training for the public, and taking the education right to where people are gathered.